on this nice, fall evening.
Yeah, it's beautiful. It's the last couple nice days.
I know. I mean, I'm in a condo, so it's like the worst. I would say the heat's finally on, but it's almost like now I don't need the heat anymore. Whereas we had a week there where I was like, I will do anything to get heat in my condo. And it was like freezing. It was overcast because the sun wouldn't even warm it up. It was like overcast for a week. And now finally it's some nice weather and we're having this workshop here. Welcome. I see everyone kind of joining in. Feel free to drop into the chat, say hi. Some familiar names here. And Jeff, we're just commenting on this lovely weather we're having. Feels like fall, which we don't always get in Canada.
That's true. As long as the snow doesn't come for a while.
I know. They're kind of saying it's going to be like a cold, snowy year. So hope not. The biggest thing is it impacts my parking at the clinic. I know anyone who comes in the winter knows we lose like 4 parking spots because of a snow pile. So
and street parking.
And street parking. Yeah, you lose it all. You lose it all. All right. Well, while people trickle in, we're gonna go ahead and get started here. So obviously you guys are here for that knee and hip pain. If you've done a workshop with us before, you'll know that we have some general rules for the day. So the first rule is have fun. We like to have fun. Oops, went too far there, guys. We like to have fun. You'll see me and Jeff having a good time, and we really want you guys to have a good time as well. Part of that having fun, I always like to start here with a nice little cartoon. I heard a pop in my knee. A nice little balloon animal there. The second rule for today is give 110%. So we're here to give 110% to you guys. And we hope in return that you guys give 110% to us. So that means type in the chat, say hi, interact with us, ask questions. Like we really want tonight to be as beneficial for you as possible. So jump in the chat, say hi, whatever you want, ask the questions, but definitely interact with us. And that's rule number 3. So be interactive, get in there. We really want to try and make this as helpful as possible. And then rule number 4 is take action. So at the end of this, we put these on because we like to help people. I mean, that's kind of why we got into this profession, Jeff, helping people.
Yes, exactly.
The greater good. So take action. So we want you to feel better. And the best way you can do that is by doing something. So you can either book a discovery call. So it's a free 15-minute call with one of the practitioners at the clinic. Or also just for showing up today, we're going to send everyone a handout on bracing for the knee. And then also an info sheet on one of the therapies we're going to talk about today. So everyone's going to get that. We're going to send that out to you guys. But to get us started, I want you guys to make sure you know who's talking at you for the next hour. So I'm Sarah DeBoer. I'm a physiotherapist at PhysioPlus Health Group. I've been there for, I think over 4 years now. I work with a lot of patients, hip and knee, post-op. I work with this population, whether it's, hip replacements, ACL surgery, all those kinds of stuff. And then also people pre-surgery, just injuries. Hips and knees are really common. We see a ton of them. So it's definitely something that's a large piece of my caseload. And then the other panelist that I'm honored to have here with me is Jeff. Do you want to introduce yourself?
Yeah, thanks, Sarah. My name's Jeff Belgue. I'm a chiropractor at PhysioPlus Health Group. I've been here for 2 years now and in practice for about 7. So certainly have seen plenty of hips, plenty of knees. I mean, knee osteoarthritis is probably as common as we get in the clinic. And of course, being a chiropractor, also my fair share of, spine related problems, spine arthritis, degenerative disc and joint disease. So I think between the two of us, we should be able to answer a few questions tonight and lend a helping hand.
For sure. I always love when I get to do workshops with you, Jeff, because we're very similar. People all the time will ask like, oh, well, it's chiro versus physio. And I always say like, between me and Jeff, like there's more that makes us similar than different, but at the same time, we like look at problems slightly differently and we, think about things a little differently. So we get kind of 2 takes on the same problem. So always love when we get to work together.
As do I.
So spin the wheel just for showing up today. We are, I'll say auctioning off, or like spinning off, whatever the spin the wheel is. we are spinning off a free assessment. So the key is just for showing up today, your name will be put in a draw. Unfortunately, we're having some technical difficulties with the spinning the wheel. So we're going to take everyone's name down. And if you win, we're going to email you. So if you've been here before, usually we end in a very Vanna White dramatic spin of the wheel. Unfortunately, that extra punch of fun at the end will not be there today. But don't worry, we are still doing the giveaway. We're just going to do that when we kind of sort out the site and figure out what's going on there, okay?
And did you say Sarah will obviously contact the individual who we will eventually spin the wheel? You'll have to trust us. We'll keep each other honest, and we'll pick the winner, and the clinic will reach out. Yeah,
for sure. We'll contact you. However, we'll hunt you down. We will hunt you down. So I want to get that interaction going. If you had no joint pain today, what would you be doing? I want you guys to type in the chat. What is it holding you back from? The knees, the hips? What do they kind of stop you from doing? It's a little ironic that we're having like a hip pain workshop today, because this morning, like, I biked and was like, oh, my hip feels off on the bike. But now tonight, I'm like, oh, that's tender. Like, feeling a little hip pain. It's like sympathy pain here. Anyone type in the chat? Make sure it says to everyone. Want to put that in? Let us know. Let us know. Kind of sounds like let it snow, and that's not what I want to go with there. Oh, Marie raised her hand. Are you guys not able to type in the chat? Maria, I'm going to let you talk here. Hi, Marie. Saw you raise your hand. Are you guys unable to type in the chat?
You may have to unmute Marie as well if you're in control there, Sarah.
Oh. No.
Oh, no.
No, there we go.
Barb is in the chat. Great.
Perfect.
So maybe a big walk, that's always good. And one thing to remember, pain doesn't always equal harm. So if you can go for a long walk and we're a little tender, we're going to teach you some strategies to help manage that day to day, but then also importantly, strategies to, prevent the tenderness in the first place. I recently had a patient with like kind of this transition time of year with knee arthritis, and she brought up skiing. So like, that's kind of like downhill skiing. That's her big goal of, building some strength and managing symptoms. So that'll be fun to work with.
Yeah, no, it's part, a little pin in it, right? We're going to talk about that later. We're talking about exercise and that fine line a little bit for sure, and managing that discomfort. See some other things here. Big walk, big walk. Yeah, that activity, just living life, like really here, stationary bike, walking over apple crisp. Everyone's very seasonal dessert. Love it. But it really is just that day-to-day function, right? That we're kind of losing. So the three biggest causes of hip and knee pain, these are what we kind of see clinically, the three biggest things. The first one being osteoarthritis. I'm sure this is one. OA, arthritis, people hear about this one a lot. You can see here on the screen, we have that healthy knee and then a load of degeneration in that healthy knee. We have that healthy hip, a little bit of degeneration in that healthy hip. This is a normal part of aging. We see various risk factors that can contribute to this, such as, if you have a high BMI or you're overweight, if you had a history of injury to these joints, then we see a higher incidence of osteoarthritic changes. So say like years ago, you had an ACL reconstruction, then you'll see a little bit more arthritis in the knee. There's some family history stuff there as well. There's a lot of factors, but there's actually a lot of factors that we don't know. And I find this always interesting, is that your x-ray can look horrible and it doesn't really always correlate to the amount of discomfort you're in, which is one of the interesting, cool things is people will come in and they could have like tons of pain and then it's like barely any changes on their x-ray, or they'll have, no pain or minimal pain and they have like horrible changes on their x-ray. It's like, oh, it's the worst knee I've ever seen. And they're like, oh, actually good. So definitely doesn't really correlate, which is always an interesting thing that we see in clinic. But yeah, osteoarthritis just is that cartilage in the knee and it's wearing down, and really it's looking a little bit different these days. So we kind of associate osteoarthritis with like, oh, that's something my grandma had, right? Like it's like this aging disease, but we actually are seeing it earlier and earlier. So 40s and 50s, we got this younger patient. They want to stay active. They're already being active. And their hope is to kind of delay that surgery a little bit and kind of prevent things from getting worse. So when we see that typical arthritis patient in the clinic now, this isn't like your grandma's arthritis anymore. It is getting a lot younger and a lot cooler. And I was like, cooler because like there's so much more we can do. It's not just like, oh, you got it. And then, okay, you're off for a knee replacement. It's a little bit more diverse. We can work with these people. We can delay surgery for years and years through bracing, through exercise, and even the surgery, Jeff. I know like I was chatting with you about this recently, how long did you say you read about like now they're making the like the actual like implant like 20 years did it last?
Yeah, I had a patient come back from a surgeon recently who was saying that like gone are like the idea that like shelf life for replacements is 10 years and you can easily push 20 now. So not to say we want people to rush into surgery, but for a select, not everyone with osteoarthritis, but for a select population, surgery may eventually be your best answer. But the good news is if that does happen, there's a great quality of life afterwards. And just to add to, Sarah's been talking about the younger, the 40s, the 50-year-olds, where there's, so much more time, so much more that you can do. But as an aside to age as well, the research is now telling us that even our older than, people in their 60s, their 70s, there's so much great evidence coming out now that like, and we'll get into it a bit, but like education, specific exercise, learning how to manage your activities of daily living, like there's lots of good quality evidence that shows us that you can improve kind of your day-to-day life, regardless of your age, if you have OA.
For sure. There's so much, like I said, it's more fun for a therapist because I all the time I've been working too long, but like this is really one of those things where you look at over the past 20 years how far medicine has come on this topic alone, and it's a really interesting thing. Before I'd be like, oh, someone had a hip replacement, like don't stand for 6 weeks. Now it's like day one, you're walking, right? Like there's been so much, progression in the world with regards to this. So a lot of those old stigmas and stereotypes and things you think of like, this is what osteoarthritis looks like. A lot of that's just not true anymore. And that's what makes it even more fun for people like me and Jeff to deal with, because there's so much that we can do. So if you think this is you, or this is you, I know we looked at all those pre-questions that people put in. A lot of people talked about having arthritis related pain. So if you have this in your knee or in your hip, if you have arthritis, just type in the chat if this sounds like it's you, kind of dealing with this, degeneration of the knee. So the second area that we see a lot of discomfort coming from are what we call muscle imbalances. So I have this nice example here of someone sitting, and you can see they're sitting in two different positions. And what you'll see is those arrows are where our kind of muscles are pulling on our hip and how we sit. So you can see they're in very different positions based on that sitting position. So I always like to bring this up to people because we sit all day and our hip flexors, that's the muscle right in the front of our hip. It gets so tight because it's sitting in a shortened position, right? Like it's kind of sitting curled up all day, curled up. I don't know if you guys have ever laid on the couch for a while and then all of a sudden you went to get up and you're like, and like it's hard to stretch it out again because you've been sitting in a short and tight position. And that happens a lot with our hips. So we sit and we get tight in the front of our hips, and then some of the muscles at the back get extra stretched and they don't work as well. And we get this imbalance, and that imbalance between our muscles starts to kind of take the hip joint or the knee joint and have it sit not in a great position. So the same idea, really the knee is impacted by the hip, but the same idea in the knee. If we're sitting with the knee in certain positions, if we're, getting tight in our hips because the hips impact the knees, if we're not strong in the right muscles, or one muscle's pulling really hard and one muscle's not pulling quite so hard, we can change how that actual joint sits and functions. And that can lead to a lot of discomfort. I don't know if anyone's ever heard the word like impingement or some of that pinching. Sometimes that pinching in the hip can come from these muscular imbalances. This is the type of person, where you see like you're sitting all day and you start to notice that the hips are tight. if you go to the gym and maybe you go to do leg day, but your hip muscles don't actually feel like they're working a ton, or you don't actually feel sore the next day in your butt muscles, it's because you're sitting on them all day and they're kind of turning off. Muscle imbalances, this is one that I want to stress, all ages. I have treated a 9-year-old dancer who just, had a little bit of a growth spurt, some of the muscles didn't quite balance around the hip pain. I have had people in their 80s who, are raking or doing a ton of gardening, and all of a sudden they're like, oh, I'm really sore. And it's like, oh yeah, like you're sitting a lot, you're sitting all winter, and then you got up to do all this activity and your muscles aren't quite balanced and your hip is sore. So this is really one of those things that can impact any age. And I would argue, and I mean, Jeff, you can disagree, but that imbalance in muscles almost becomes a piece of every condition. It's just, is that the sole driver, or is that sort of like a side piece?
Totally. Yeah, completely agree.
Yeah, for everything, the balance, it's not just being strong, but being strong in a balanced position. Great question, Barb. What position on this chart is correct, A or B? Neither. So both of them are showing the extreme. What you would want is something kind of in the middle. So both of those are showing, like, the one on the left is like all the way arched forward. The one on the right is like all the way arched back. Both of those aren't right. Somewhere in the middle is actually what would be right. So that's actually showing the two kind of extremes of, we don't want to be here, we don't want to be there. You want to kind of find that nice spot in the middle. That's a great question, Barb. Thank you. So if you think this is you, I want you to type imbalances. If you think, hey, that sounds like me, that those tight hips from sitting in the front, then I have trouble standing up straight, or you try to work your glutes, doesn't matter how hard you work, those glutes just don't turn on, you don't get that soreness in the bum muscles. If you think this is you, just type imbalance in the chat. Nice. See a couple people typing here, imbalance. Yeah, it's common. It's like this Western...
It's probably all of us, to be honest.
Yeah, we can just type my name, Sarah. Yep, that's me, imbalance. Gonna have a little after sitting today. But as a Western society, we spend so much time like sitting, right? Like me and Jeff are very fortunate to have jobs where we're on our feet all day. But it really is just like, even on weekends, like, I watch a little football on Sundays, all of a sudden I'm like, ooh, has it really been 4 hours since I, moved around? It happens way too easily. So the last kind of main cause that we see in this one, again, I guess that, it does bleed into other areas, but sometimes this can actually be that main cause, is poor form. So when we say form, that's a very exercise-based word, but really we're looking at how you move. Okay, so how your joints, what position they're in. You can kind of see on that right, that clear example of, where are my knees in relation to my toes? How much am I moving? Poor form comes in, muscle imbalances can lead to poor form, osteoarthritis. So when you have degeneration in the knee or the hip, I always like to say that your joint space, so on an x-ray, we should see a nice black joint space. As we get away, that kind of decreases. I like to describe that just as we age, whether you are diagnosed with arthritis or not, as you age, your wiggle room for improper movement generally decreases. So I like to give the example of, like, everyone's kind of, seeing their like 4-year-old kid, or seeing their maybe grandson, or like they're like sleeping like that, and then they just wake up in the morning and they walk, like they're like, it's fine. The like W sit position. The teenagers are like in a ball hunched over just for hours, and they just stand up out of it. And you're like, wow, if I sat like that, even I say I'm young, and even if I sat like that for like an hour, if I sat like that for 15 minutes, I'd probably be like, yo, somebody has to help me off the floor here. Our wiggle room within our joints for not moving well, or not being in the right position, it goes down as we age. So a lot of times we'll look at something about like how somebody does a certain movement or does a certain exercise, and they're like, well, that's just always how I've done it. And it wasn't a problem 10 years ago, but it becomes a problem now. So again, this can be caused by muscle imbalances. This is one of those things that we really want to look at when we look at, arthritis, because we're looking at that joint space. It's narrowing. Our wiggle room for improper movement just goes down. It's not that we can't move pain-free. It's just that we have to be mindful about how we're moving, as we can't move like we did when we were 7 years old and our body was made of noodles, right? It's just a little different. But this is something that definitely, if you think this is you, one more point here. So you can also see when we look at that kind of poor form, I always like to show this, especially when we talk about knees and hips, they're so interconnected. We threw them together in this workshop because you can't take one out of the other one. So when we look at poor form, it's the positioning of our knees, but also that impacts the positioning of our hip, right? So if I go back a photo, how do I go back? Ooh, there we go. If I go back, right, you look at just lifting and you look at the squat, and it doesn't directly see picture to picture this huge change in the hip, but you can see the knees are in a very different position. And here you can see how that knee being in a different position, you can kind of see what ends up happening up at the hip and at the feet as well. So it's the whole kind of lower extremity, it's everything about how we move. And we just need to be mindful that the worse we move, the more likelihood that that movement is going to be painful. But again, yeah, so type form, this sounds like it's you. This one kind of feels like it's a piece of a lot of people, right? Well, whatever their diagnosis. Wendy form. Yeah, so
this is yeah,
sorry,
I was just gonna say this is an interesting one too, because like form is, or movement quality is a lifelong battle, like it's very similar to like posture. That's just static form is, there's no magical fix. It's mindfulness, it's practice. And like you could be really good for a day and then you could go, empty your dishwasher like that far picture on the left and, twinge your back a bit. So you gotta earn this one. You gotta learn how to move and then keep on top of it. And that's how we stay well.
For sure. It's a habit. It's like the classic, like practice makes perfect. All right. So big question. Exercise. This is a huge one I get all the time. Like, I need to be stronger, but exercise hurts. Or how can this make me better when the consistent thing that hurts me is exercise, right? This is a big question we get. And I always like to kind of say to people, it's about finding the right exercise, right? So if you, again, it comes down to the form a little bit as well, right? It comes down to the muscle imbalances, right? So we're going to pick an exercise as, a huge piece of what we do. We're going to pick an exercise. If we see you have muscle imbalances around the hip, we're going to really specifically pick an exercise that's going to strengthen the weak muscle while letting the strong muscle or tight muscle rest, right? If, you have poor form doing a squat, well, we're probably not going to have you do 200 squats because that's probably going to hurt and feel quite uncomfortable. Really, when it comes down to picking exercise, and is exercise the solution or the problem? There's this old thought, and back in the day, there was the thought was that running caused knee arthritis. It's still held by a lot of people who use kind of like, oh, well, it's because you run and you're a runner and you cause knee OA. And it came from this idea that people would run, their knees would hurt, they'd go to the doctor, and the doctor say, oh yeah, your x-ray shows you have knee OA. That's running caused that. Running caused you to hurt, and therefore running caused you to have knee OA. And this thought was held for a long time. And then they actually did some retroactive studies. And when you look at it, if you run, you actually have a lower likelihood of getting osteoarthritis. Because if you are a lifelong runner, generally all the other factors, that means you're healthy and active. That means you generally have a lower body mass index. That means that you, again, engage in healthy behaviors. Like you see lower rates of smoking in people who are runners, right? All of those other good quality characteristics that come from being a runner way outweigh any potential loading on your knees that can come from running, right? So there's not this blanket, this is a good exercise and this is a bad exercise, or exercise is bad, or all exercise is good. It really is so nuanced to the patient in front of us. Like having individualized exercise programs is one of the most important things, like having the right exercise for that condition.
Just quickly in the chat, Michael was asking about weights, and similar to Sarah's explanation about running is resistance training is an excellent way to build strength and help manage arthritis and again even prevent arthritis, because you're moving your body through quality movements, I guess. So the big word there is quality. So weight training well in a somewhat decent form is really good for you also.
And that's the biggest thing, right? We get people who come in a lot and they're discouraged because they try to exercise and the exercise causes pain. And it comes down to, hey, we have a form issue, we have a muscle imbalance issue, we have these things that we need to address. And then it's just picking the right exercise and really approaching it the right way that, is not only backed by being experts, but the research and what we know is out there for that condition, right? We know that if you come in and you have super tight hip flexors, just stretching your hip flexors all day doesn't actually get you in a better place. But if you strengthen the hip flexors and you strengthen the glutes, we know that you actually will get less tight in your hip flexors. And, there's so much knowledge out there. And it's really just making sure that you're doing the right exercise for the condition you have, whether you're the arthritis bucket, whether you're the imbalance bucket, in that form bucket, or across of all three. It really is, exercise is the answer. It is always the answer. Moving is the answer, but it's working the right muscles and doing like really just good form, that therapist guided, that making sure you're moving right, good form. So that kind of leads us into our next piece when we talk about exercise and what is that kind of right exercise for certain conditions. And this is a huge treatment that is really popping up everywhere. I'm sure a bunch of you have heard of it, and Jeff is going to chat a little bit about it.
Yeah, so thanks, Sarah. So the GLAD program is this new education and exercise-based program for those with hip and knee osteoarthritis, or those who are sort of on the cusp, who deal with kind of like daily stiff and painful knees or hips. It's no secret osteoarthritis is, a leading cause of disability like worldwide. And that's sort of what pushed this group, from this research-based group from Denmark, to, scour the literature, reach out to researchers, to clinicians, and collect this kind of super team across the globe to build this program that, again, can help people around the world. And so what it looks like is it's a 7-week program. It's run twice a week. 2 sessions are completely education based, like almost lecture style, followed by question and answer, where participants get to learn about exactly what osteoarthritis is, risk factors, symptoms you're either experiencing or may experience later, the evidence-based treatments for osteoarthritis, how to manage your symptoms day to day, and specifically, like we've talked about a little bit, what types of exercises are best for you. And then we take all that education and knowledge and then push that into 6 weeks of exercise sessions, where you do it in a small group with a certified therapist. So not only are you learning this, researched, well-designed program for people with arthritis, you're also getting this, very small group, trained professional eyes on you, because like we mentioned, it's about the quality of the exercise, the quality of your movement. And if Sarah just flips back one slide, the program's been around for a few years now, but it's kind of becoming more and more popular. But they've had enough time to track participants and collect results. And there's statistically significant findings in participants reporting less pain, the reduced use for painkillers, and I think anti-inflammatories as well. Obviously, this one's probably not a shocker. It helps people lead more physically active lives. Again, the big takeaway is that you're sort of across 7 weeks learning how to manage yourself for years. You get a load of education, you learn an exercise program, and you learn how to do that exercise program well. And you invest in these 7 weeks, and then that turns into all this opportunity to continue to work at things on your own. So I mean, the reason why we're putting this into tonight's presentation is because at the clinic, we're launching, we're running the GLAD program ourselves. We're launching it actually next week. So it runs from November 1st to December 16th, and it is held to small numbers. We don't exceed 6 to 8 participants, but there is room for a couple more at least. So if anybody is interested or is going to go do a bit more reading and has a few questions, you're welcome to set up one of those discovery phone calls. I'm happy to discuss the program more in depth or answer specific questions. Especially if anybody wants to quickly get into the program for this running, but it's something that as we get it off the ground, the clinic is going to run, maybe like quarterly or a few times through the year. So it's something that, because it's such a wonderful program and we know it helps people, we're going to start sort of offering to people throughout the calendar year.
Yeah, if you want more information about this piece specifically, I want you guys to type GLAD into the chat, and Jeff will reach out to you. I always kind of joke about this. In the world of rehab, everyone always likes to think they have the right way. And it's really funny because you'll see across the world, like in Australia, they're like, this is the best way to rehab an ACL. And it's like, no, this is the best way to rehab. But the craziest thing about the GLAD program is that it really is like the world, every country is like, yeah, no, we'll do what Denmark did because it really works. Like, it's one of those things where it's impressive how like taken up it is by so many people in the world. It is such an amazing, and as you can see here on the side too, it's eligible for your insurance benefits. Like, hey guys, it's the end of the year. Like, that stuff, you don't get it, you use it or lose it, but it's an absolutely amazing program. Like, somebody just chatted, this is like perfect. Lynn, I'm gonna read what you said. I attended the GLAD program 3 years ago for knee OA, and it was wonderful. And marked improvements, continue to those exercises on a regular basis. Like, it really is one of those things, like you said, it's not just the intensive, but that they're training, like Jeff said, he's going to train you for something that's going to be forever, right? These exercises are going to carry you forward for years and years and hopefully delay any potential replacement as long as possible. And it's for knees and hips. So yeah, thanks for chatting about that, Jeff.
My pleasure.
So this is a big question that we are, get a lot is, I am in pain. It's already come up. Like, I did a lot today. I did too much. I'm in pain. I'm in pain. I'm in pain. And how do I feel better? Like, you're living your life. You're trying to do exercise. You're trying to stay active. And you want to really know how to kind of tackle that pain. And this is the question we get a lot. Ooh, went too far. There we go. This is the question we get a lot. Ice versus heat. When do you use which one? So let's go into like the buckets of kind of three causes we had. So the first one is osteoarthritis. So osteoarthritis by nature is not an inflammatory condition. So there's not actually an active inflammation there. I always say if you just did something, you're like literally walking in the door, coming off of a big walk, then you would maybe consider ice for those first 20 minutes. But otherwise, heat. Really, there's no inflammation. Those knees are achy at the end of the day. Heat them. It's going to bring some blood flow to the area. It has oxygen. It has nutrients. The heat itself has what we call an analgesic effect. So it just decreases the pain that you perceive. And it feels good. We're getting to the cold time of year, folks. It's going to be so nice. Just put a nice little heating pad on your hip or your knee at the end of the day. So really, arthritis, heat is the big winner. The second one, imbalances. If you are having pain at rest, so you're in a lot of discomfort, it's not with movement, you have pain at rest, that's really where you're going to go to that ice kind of category. Versus like the heat would be, you have no pain at rest, but the muscle just feels tight or angry. Then you want to try the heat. And for form, really, that's kind of a toss up. There's not one thing to do. And if there's nothing else you take away from this slide, listen to your body. If you put one on and it doesn't feel good, do the other one. We can say these rules, but it's nice because it's like, we'll say like low risk, high reward. If you're like, ooh, like, the ice kind of helped, but then as soon as I took the ice off, it just thawed and I'm in pain again. Well, then try the heat. And if you're putting the heat on and you're like, oh, the heat, like, oh, is it making it more sore? I don't know. Well, then take the heat off and put on some ice. There's these general rules. We have these categories of when you might choose one or the other. But at the end of the day, it's not perfect. And listening to what feels good on your body really is the way to go. Are you an ice guy or a heat guy, Jeff?
I don't really have a preference actually. So I'm a what feels good for certain injury or ailment? I know you're definitely a heat person. You wear sweaters and pants in the summer at work, so
Oh, yeah,
no way
no,
to put ice on your
I
body.
hate the cold with a burning passion. Like something has to be like genuinely actively inflamed for me to reach for that ice pack over the heat. My reputation in the clinic is like everyone will be in t-shirts and like sweating, and I wear like an infrared heat jacket over top of my long sleeve. I'm always cold. Always cold. So definitely the way to go for me is heat, but again, you gotta listen to your body. So type in the chat who can answer this. Anyone who's been to our workshops before hopefully knows the answer. This is the number one mistake that pain sufferers make. Does anyone have a guess? It's always the same answer, guys. Spoiler alert. The number one mistake that people who suffer from pain make consistently, time and time again, whether it's pain in the hip, pain in the knee, pain in the foot, pain in the back, stop exercising. That's a good one. It is a very common one. It was not the one we were going for, but it is true. People just are like, oh, I'm gonna kind of shift what I'm doing, and that'll come up here as well. So really, the number one mistake pain sufferers make is they ignore it. Yeah, Marilyn, there you go, ignoring it. Right? People are like, oh, it's fine. Just gotta power through. No pain, no gain. Just gotta put your head down, push through, and ignoring it. And that's not the way to a solution. Just ignoring that it's there. It really seldom do issues get better. A lot of times people come in for assessments. They're like, well, I waited a month, so I maybe get better. And I was like, well, did you do anything? They're like, no, I just kind of ignored it. Unfortunately, that's not how our body works as much as I'd like it to be. But Barb, here we go, alter it. So alter it or alter our life. So we can either alter it with, pain medication. We're constantly popping pills to make ourselves feel better. We can alter what we're doing so we can stop exercising. Be like, oh, it hurts when I exercise, so I'm just not going to exercise. It hurts when I stand for too long, so I'm just going to avoid social outings in which I need to stand for too long. Right? We start altering either the pain or we start altering our life instead of actually doing number 3, which is handling it, right? Getting to the cause, dealing with it, doing as much as we can to not have to ignore it, not have to alter it, but just be able to live our life, without having that pain constantly pestering us. So what's next? Rule number 4, okay? So rule number 4 was take action. I said this at the beginning. I'll say this again. We do these. We want you guys to feel better. We're going to open this up to questions like later. We have some questions that were there from you guys put some questions in before, which was awesome. Really, we're here to help you guys. We do this because we like to have people feel better. That's why we're in this profession. And at the end of the day, we want you guys to feel the best you can. So take action, either book a discovery visit. So if you want a discovery visit, this is a free 15-minute consultation. Type discovery in the chat, or just start treatment. If you're like, hey, I want to feel better. I want to get on top of this. I don't want this to keep suffering from osteoarthritic changes or hip pain or knee pain. Start treatment, whether it's with us or someone else. At the end of the day, we just want you guys to feel better. And one of the things that we always stress is what is proper treatment. So really, these are the 3 pillars of what proper treatment looks like. For a lot of conditions. Education, huge. So much of what we do, I never forget when we first went to virtual, and all the time people were like, oh, virtual, what you guys do is hands-on. I was skeptical too, and then patients were getting better just by me guiding them through and educating them, telling them, this is the best way to move, educating you on how we get muscle imbalances, educating you on poor form versus good form, educating you on osteoarthritis, things to avoid, things to do, better exercises, right? Taking that GLAD program where you can get those fundamental pieces, right? So important. Manual therapy. So this is, that category where a lot of people associate with us. It's the hands-on. The hands-on really, it does help the symptoms. It can feel good at the time. It can help some of the underlying causes as well. There can be some real things going on there, and that manual piece should for sure actually have some hands-on treatment. So modalities have a role, but your therapist should be putting their hands on you and giving you some quality treatment. And that last piece, exercise. I said it before, I'll say it again, especially with the hip and the knee. At the end of the day, the solution is strength more often than not, eh, Jeff? It's getting them to be pain-free enough to strengthen.
Of course, totally.
It's strength grease is the word. No, strength is the word. That's really what it comes down to. So your therapy, it shouldn't just be the passive, the hands-on from the therapist. It really should have that exercise piece as well. Okay, so make sure you're getting that proper treatment. So again, I want you guys to type in the chat. So it's a free 15-minute scan. It's a virtual scan. Someone will call you. We set it up. We book it in our schedules. You'll meet with Jeff or myself. We'll, talk to you about your issue. Is GLAD right for you? Does it sound like it's foreign, an imbalance? What can you do that will help you feel better? Where's the solution? Really any question that is personal, anything that you don't want to maybe put in the chat here, but you want an answer to, that's what those 15 minutes are for. They're your 15 minutes to ask us anything you want. Generally try to keep in the hip and knee region, but if you threw out like, oh, I have this neck problem, we'd probably take that too. So whatever you want to talk about for those 15 minutes, you book it, and our attention is all yours. Or if you're like, you know what, I just want to start feeling better, you can put in, type in assessment. Say, hey, I want to get started. I don't want a 15-minute. I want to get in. I want to get an assessment. I want to get treatment. I want to feel better tomorrow. I want to feel better as soon as possible. Type assessment in the chat. We're going to book that assessment for you. Or just a reminder, type in GLAD. Put GLAD in the chat if this is something that you're interested in more information on. I can't tell you the number of patients who have had such a positive experience with the GLAD program. It is really one of the most research-backed, it is very impressive. And again, it really is such a powerful piece because it's more than just those 7 weeks, right? It's more than those 2 education and 12 exercise sessions. It's giving you information, giving you tools for forever. So it's so valuable. So type in the chat discovery, type in the chat assessment, or type in the chat not sure. If you're like, Sarah, Jeff, I don't believe what you're selling. If you have any questions, I will contact you personally. Type not sure, and we will definitely get back to you. I'm going to leave this up so you guys can think about it, type those in, and some of them clinic will contact you. But we're also going to open it up to the Q&A now. So if you guys have any questions, you can feel free to type those in the chat. Jeff, do you see some things coming here? I'm just going to pull up. We have all of our list of the questions you guys asked before, and we're going to field some of those as well. Oh, here I have, what are your thoughts on inversion therapy? Jeff, I feel like that's a very chiro question.
Yeah, so I'm assuming unrelated to the hip and knee, because inversion for those 2 structures is probably pretty out there. But speaking inversion therapy regarding spine, it's, well, I guess if I start with the research, it's so-so. There's been a little bit of decent documentation that inversion, which leads to traction in a sense, depressurizing the spine, it can be helpful for that disc herniation patient, nerve compression type patient. The problem I find clinically with a few people who have told me they have a table or they've tried it in the past is it tends to be good for those kind of ailments, but it's never just that. Somebody who's suffering from a disc herniation or nerve pressure or impingement, they also have muscular spasm and tension. And so if you take somebody and flip them upside down, I find that gently, of course. It's not something we do, but the tables are
hang them by their feet, throw them upside down.
But what I find is, maybe there's some benefit for the intervertebral disc or the nerve pressure, but most people are going to have that level of tension, you're literally tilted, inverted on a table. If you can't relax, you get tense. Maybe the muscle spasm gets worse. It's a very unfocused treatment. So I almost tell people if you're healthy, you don't have a specific ailment, then some gym goers will like hang from a chin-up bar and like decompress their back, or other people will use an inversion table. Like for somebody without a specific ailment, it's not a bad thing to do. Like it's decent, but if I'm not so on board for the like, you have a back problem, let's get you on an inversion table for X amount of, minutes per day and sort of program. I think there's some kind of like, hoaxy programs out there that take advantage of people in pain. But yeah, I know that's a very convoluted answer, but it's
especially when it comes to like purchasing it, right? Like,
yeah,
it really, I think I agree. And I think it's one of those things where it's like approached with caution, right? It's kind of like if somebody was like, oh, like, how do you think, PRP injections are? And I'd be like, well, if you get the right case with the right things, I think they're great. Or how's cortisone? How do you think cortisone injections are? I was like, okay, again, if you got the right person with the right case. Now, if somebody fell and broke their arm and they're like, oh, we should just inject cortisone, I'd be like, no, I think they need a plate to stabilize the fractured bone. Like, it's one of those things where I think people think A equals B, and it's like back pain always equals inversion therapy being a valid treatment option. And it's just it's not that cookie cutter. It's not that clean cut. And it's really knowing what's going on, having a therapist maybe look at you and they can diagnose if you got neural tension or what's going on, or maybe like, hey, you don't got neural tension, you can relax, you're super disky, sure, let's invert you. Like, it's just one of those things where it's not a blanket statement. It really is a classic physio answer. It depends. But it really, it's a good treatment for the right condition, but people too often think every condition is the right condition.
Yeah, fair. Well said.
Thank you. Some other questions we have. Somebody said, can you put on ointments for hip pain? So I think it's people talking about, like got those topical creams. I know like CBD creams are kind of big things right now in THC, Voltaren, right? There's a lot of different topical things. What do you say usually, Jeff? Yeah or nay?
I know it's crummy answers, but case by case basis. Like most topicals are an anti-inflammatory. So, for a person with an inflammatory based issue, they certainly can be helpful. But I know you'll say the same thing, Sarah. Like technically, it's outside of our scope of practice. So, beyond our personal recommendation. Honestly, probably speaking to even like pharmacists are an underutilized, profession who are right there. Like if you have questions about Voltaren or over-the-counter medication, those things, like they can speak to more of the ingredients and the quality of the product. But, all in all, if it's an inflammatory based issue, like a hip bursitis, and it's focally tender and inflamed, like you'll probably get a bit of benefit from a topical, same as, with a bit of ice or a bit of heat. It's another tool in the toolbox for people at home to try to feel a little bit better. And so I kind of take exactly what we said about heat and ice, like trial and error. Most topicals are very safe to use, so you're not going to do any harm. Read and follow the label and directions. And if it helps, wonderful.
Yeah, I totally agree. Again, chat with the pharmacist. The only other thing that I'll add that is, I'll say within our scope to a certain extent, is you got to ask yourself critically, what is the structure that you're treating? So if I put a topical ointment on the outside of my hip, I do not believe that is in any way getting inside of my hip joint capsule. Right? Like, I think it comes down a little bit to talk to the pharmacist, ask yourself, like, what am I looking for this to do? And then ask yourself, and some of this education might come, from the pharmacist, from something like the GLAD program about like, what do we know the research really says helps? But like Jeff said, at the end of the day, like they're safe as long as you're run by a pharmacist and they're like, yeah, go ahead. Give it a try. If it works, great. And it's not like there's a huge side effect to it not working. You might just be a little greasy on your skin for a little bit. Another question I have, which is getting into the same thing. Vitamins for joint pain. It's a big one. I don't know if this gets touched on at all in your GLAD program, but again, a nice little one outside of our scope. But what are your thoughts when people ask you about vitamins, Jeff?
Yeah, specifically to arthritis, GLAD does cover it a bit, and it's sort of that like secondary level of the research is like plus or minus on supplementation. There's like glucosamine sulfate, glucosamine chondroitin sulfate. There's a mix of sort of common cartilage based, even collagen now is another newer supplement where most of the time there's some studies out there where there are a bit of positive results, and then there's a bunch of studies out there where there's no real statistically significant improvement. So unfortunately, again, it can help some people. It doesn't help others. With more time, we'll be able to tease out why it helps people and it doesn't. But similar to the topicals, most of the time, these supplements are safe to take in short periods of time and doses. So speaking to a doctor, speaking to a pharmacist, you can kind of identify if it'd be safe for you to take and, give it the college try. And if it helps you feel better, it's either working or it's a placebo and something else is helping you in your life. But there's no real harm to try.
I agree. It's one of those things where, there's naturopaths and nutritionists out there who this would be more within their scope. But there's a lot out there. And to be honest, like just conjecture here, everyone I talk to agrees, or like some people swear by it. Like some people, my mom takes something. I want to say that one with chondroitin in it. Glucosamine chondroitin, but swears it works. It's like just swears by it. But then it's like there's other people who take it and it doesn't work. It's one of those things where it's a tool in the toolkit, just like the ointment, just like all that other stuff. And it's definitely worth looking into if you're trying to kind of take all approaches possible. So last question that I'll have here is somebody's talked about footwear a little bit, like proper boots, other footwear at home, inside. So really it's looking at, again, that role that footwear might play. And I throw it back to that slide where we kind of showed the hip, the knee, the foot. The foot is for sure a player. We see a lot of people who have knee osteoarthritis or knee issues or hip issues. We do work with a great chiropodist. He's absolutely amazing. He will look at you and say, yes, you're a candidate for an orthotic, or no, you're not. And he really does, like it makes an improvement. So if we're looking at things that at the end of the day are able to help you stay more active, do more things, footwear is a big piece for sure. Again, depends. It depends. I keep saying that, but it depends on like what your situation is. So this is not to say that if you're in bare feet, putting shoes on in your house is going to solve your problem. But for some people, it might make a difference. And it's one of, again, the tools in the toolbox, the options that are available and out there for you. Any last questions, type them in the chat. Otherwise, that is all the fun we have for you on this Tuesday evening. I want to thank everyone kind of coming out, typing in the chat, participating. Always fun. Like I said, we're going to do the spin the wheel, and we're going to contact whoever has won that free assessment. So yeah, thanks so much for coming out. And thanks, Jeff, for being here.
My pleasure. And those, there was a few who wrote discovery or glad call, etc. We copy the chat and we'll have the admin team slot you into our schedule. So we'll reach out to book something.
Oh, no problem, Michael. Yeah, definitely. It's not too late. Type in GLAD, assessment, discovery. If you want any of these, we can definitely still contact you. Or not sure. Still a valid option. So Jeff, what do you think? Did you officially dodge bedtime? Do you think they're sound asleep, your little guys?
Yes, I for those who are listening, I have 2 little kids at home and they should be asleep. Should, the key word.
And for anyone who ever wonders how we pick the time of our workshop, we ask people, what time in your life would you like to get out of the most? And then we book it at that time. Yeah.
The witching hour and bedtime routine. Take a night off.
Awesome. All right. I'm gonna end that there as people kind of slowly dwindle away. I'll save the chat as well. And then, yeah, that's all the fun for tonight. Another workshop down.
Yeah, excellent.
Trying to, oh, stop sharing. There we go.
Done.
All right. I will, I'll see you tomorrow.
No,
Actually, probably
Thursday.
Thursday. I don't work Wednesdays either. What am I saying? I'll see you Thursday.
All right. See you, Sarah. Take care.
All right. Bye.